All right, good morning, Jana. I appreciate you joining me today. Today I have Dr. Jana Magarian. She's the owner of Pelvic Performance here in Jacksonville, Florida. I have known of her and worked with her for a while now, and she is a women's health specialist and a pelvic floor specialist. And so I brought her on today just to shed some light on some common discomforts and aches and pains, but also just expose people to what she really does. And I know that's a big thing in the PT realm, but niching down to the pelvic floor and pelvic health, that's even more challenging. So thank you, Jana, for joining me today.
Thanks so much for having me.
Yeah, absolutely. Okay, so give us a little background of yourself and kind of how what led you to pelvic health.
I was born and raised in Jacksonville, Florida, which every time I tell someone that, they say that that's rare. And I guess it's just because a lot of people have moved here recently. But I went to UCF for my bachelor's degree.
Awesome.
When I was in high school, my brother tore his ACL and his MCL and a bunch of other things playing football. And he had to go to physical therapy after he had surgery, and he drove us to school. So I had to go with him to physical therapy after
Okay.
our classes got out. And so that was my first exposure to physical therapy. And so I kind of recognized in high school that I wanted to be a physical therapist. And at that point, I had become a doctorate program. So I knew it was going to be a lot of school. So, like I mentioned earlier, went to UCF for my bachelor's and then got accepted into the University of North Florida back in Jacksonville for my physical therapy program. And then I would say in PT school, that first like year when we were dissecting the cadavers in the anatomy lab,
Yeah.
we had, once we had gotten to the abdominal pelvic region, we had a pelvic floor physical therapist come and help us dissect. And up until that point,
Oh, cool.
I don't know if you had the same experience. I didn't even know that you could specialize in pelvic floor or women's health.
Mhm.
I just kind of got into PT school thinking I would treat more of like the athletic population.
Mhm.
And this pelvic floor physical therapist, as we were dissecting, started talking about all the patients that she helped. And I
Mhm.
really liked what she was saying. And I turned to my lab partner and I said, I'm going to be a pelvic floor physical therapist. And he was like, You're crazy. Um,
Of course.
so that's kind of how I decided that I wanted to get into that specialty. But
Yeah.
I'm sure maybe like you experienced in your PT program, we had like 2 days of a lecture of pelvic
Yeah.
floor PT in the entire 3 years of the doctorate program. And so I
Yeah.
knew that if I wanted to be good at it, that I would have to get extra training. And so I decided to apply to Brooks Rehab, which is a big, rehab
Yeah. Yeah.
facility here in Jacksonville, to their residency program, and did that right after PT school. So yeah, that's kind of my journey into becoming a women's health pelvic floor PT.
Heck yeah, yeah. I know I can appreciate every bit of that. I think in PT school, what I tell people is they basically teach you how not to really hurt somebody.
Mhm.
But if you really want to get good, like specializing is the way to go. And I just know from doing the orthopedic residency when we talked about pelvic health issues, like it's a whole different ball game. And that level of education, it's not on our PT boards. It's like you're just going above and beyond.
Yeah.
And I know some of the Con Ed and the training that you've had is very in depth and intimate, and that's the whole pelvic health realm, right?
Yeah, absolutely. And I think you said it perfectly. I think one of our instructors in our mutual residency,
Mhm.
Bob Rowe, he said it's really hard to be good at everything.
Yeah.
And I think a lot of people view physical therapists as like general
Hmm.
practitioners and that like
Hmm.
if you work at an outpatient clinic, you're expected to be able to treat the patient who's had a stroke, the patient who's had knee surgery, and the patient who has balance issues. And I
Hmm.
think it's really hard to be good at all of those things unless you've had, a lot of training.
Yeah.
And I do think that our field of medicine, physical therapy, might start turning towards more like specialized practice, because
Hmm.
I think patients can appreciate when people like you and I have gone and gotten this extra training.
Yeah, absolutely. I think there's a time and place for both, and you can definitely see and feel the difference from a client perspective when you're seeing somebody who's a specialist or not. And there's no fault to be passed at all, but I think you can just tell, like your outcomes change and your patient interactions change, and so when a client teams up with more of a specialist, whether it be orthopedic like myself or pelvic health like you, and then take it a next level of being more of a concierge, like coming out to your house and really taking care of you, like things just become different. And especially in your realm, like you need more of that intimate, personal approach because a lot of stuff you're talking about, I mean, it's tough to talk about, right? It's not the easiest conversations to have. And so I think you're doing awesome things. And so you are mobile, right?
Yeah, just like you, I found a need from a lot of my patients because a lot of the patients that I serve have recently had babies
Mhm.
or have multiple children, and it's really hard for them to rally all their kids and come to a clinic, even if it's just
Mhm.
once a week. And
Mhm.
so I really felt like I needed to go to my patients' houses to see them, especially if they're really early postpartum and they're still, struggling with like bleeding and getting out of
Right.
bed because they're not sleeping or they're breastfeeding. And
Yeah.
it's so nice to be able to serve my patients in their house because if their baby starts crying, they don't feel like they're bothering anybody else in the
Yeah.
clinic.
Yeah.
If they need to stop and breastfeed, we're in the comfort of their own home. And
Awesome.
so, like you mentioned, it's really nice to be able to go and see them in their environment, and see what we can use that they already own, that they don't have to go out and buy like extra equipment because I can see what they already have. Yeah.
Yeah. Yeah, those are all perks of the mobile model, right? And people understand that when you come out to their house. And so I think it's great. Yeah, I think it's exactly what is needed. What is something that you wish people knew about a pelvic health specialist or just the pelvic floor in general?
That we exist.
Yeah, yeah, there you go. Right.
Yeah,
You want clients and providers to know that, right?
yes.
Yeah.
I was just having this conversation with a patient yesterday. She was just kind of saying like, I don't understand why this isn't the norm, why
Mhm.
it's not automatic that after you have a baby that you go and see a pelvic floor physical therapist. And I was
Yeah.
explaining to her that in other countries it is, and in France, I think in particular, you automatically, if you have a baby, you get 6 weeks of pelvic floor PT.
Mhm.
And to my understanding, the patients go, it would be like not going to your follow-up appointment after you have a baby. It's just you
Yeah.
just go. It's the cultural norm.
Yeah.
And
Yeah.
I think it's surprising knowing that we live in one of the wealthiest countries in the world and we apparently have one of the best healthcare systems in the world, that pelvic floor physical therapy isn't talked about by medical providers as much.
Yeah.
If you think about a woman's experience during her pregnancy, she's most likely seeing an OBGYN. Um,
Mhm.
and a lot of times they're not talking about pelvic floor PT and they're not bringing it up at that 6 week follow up after you have a
Yeah.
baby. A lot of my
Yeah.
patients told me they had to ask about it. I
Mhm.
would say midwives are definitely better about referring because they kind of fall into more of that like naturopathic realm and they
Yeah.
really appreciate other providers like chiropractors, PTs, doulas
Yeah.
being in a collaborative approach to treating their patients. So I would say midwives are definitely better about referring. And this is no shade to OBGYNs. I just think that
Yeah.
there's somewhere a lack of communication in that like I think 100% of women that have had a baby need a pelvic floor physical therapist. Just it would be like having a knee surgery and not doing PT. Like
Yeah.
your body is changing so much. You've carried a baby inside of you for close to 10 months. And even if you've had a C-section, that's a surgery. And to not do rehab after, to not even have the option of being told about it is
Mhm.
something that I wish would change. And I hope more people just know that we exist.
Yeah, yeah, I think I would echo all of that. My wife's had two babies now, and like we're lucky enough to both of us be PTs, and we kind of have an idea. But from a client's perspective, I mean, it's hard to get, even if you're just like, oh, I'm okay, but then you have questions, and like the pelvic therapist is there to answer those for you. It's your body, and so I don't know how many times you're trying to Google questions or try to figure it out on your own. You don't have to do that. Like you can, I know, I absolutely know this, like with your model, like if they have a question, they text you, you know what I mean? Like they just
Yeah,
reach out to
for
you.
sure.
So, and it's the same way with me. Like we're there to reduce the gray. So even if you don't feel like like if you feel like your body is okay, like there's still a lot to be gained there. And it only helps the providers as well. So you don't go in with all of these questions. And if you really need, there's just something serious going on, we can get that addressed pretty quickly as well. So yeah, absolutely. Absolutely. Yeah. And so speaking of the pelvic health realm, like what are like the top three things that you treat, like that you see?
I would say urinary incontinence.
Okay.
That can happen because you've had a baby. That can happen because you are approaching menopause or postmenopausal. That
Hmm.
can happen in men that have had prostate cancer and maybe they've had surgery.
Okay.
So that's probably why it's my number one thing that I treat because it
Okay.
it doesn't just happen to women that have had babies. It can happen to women who've never had children. I would say diastasis, rectus abdominis, so
Okay.
that abdominal muscle separation that some research shows that 100% of women experience at some point during their pregnancy.
Mhm.
And I'm typically treating that during their pregnancy if someone calls me during their pregnancy, but a lot of times after in the
Mhm.
postpartum phase. And then probably
And if no one knows what that is, it's the natural separation of your
yes,
abdomen
abdominal.
that's
Yeah.
supposed to happen. But a lot of times it looks very weird and it can feel weird, and you have a ton of questions like, do you exercise? Do you strengthen your core? And those are all questions that you answer. But in case no
Yes.
one knows what that was.
Yeah, a lot of patients will turn to like Instagram and try to get answers, and then they'll
Yeah.
find like, I should probably see someone that has studied this because you'll get conflicting answers
Yeah. 100%.
regarding what exercises you should do. But
Hmm.
the third thing I probably treat is just pain and
Okay.
in general, like some sort of pelvic, low back,
Hmm.
hip pain. I would
Totally.
say most of my patients, they don't just have like one issue.
Totally.
They might have incontinence and then also have hip pain because we know that the pelvic floor muscles are providing a lot of structural support to that whole pelvic girdle. And so if they're
Hmm.
incontinent, it's probably because it might be because their pelvic floor muscles are weak. And
Hmm.
if their pelvic floor muscles are weak, then that can lend itself to some pain in that
Yeah.
region.
Yeah,
Yeah.
absolutely. And whoever's watching this, like it is not normal to sneeze or exert yourself and have some leakage. Like that is not normal.
Yeah.
And a lot of women in my life and that I've seen clients go through, they're just like, oh, that's just something that kind of happens here and there. And I'm like, that thing needs to be treated now. Like you need to learn how to treat that now. It's not normal. And so I think there's a lot of we're trying to normalize all of this stuff that shouldn't be normal, and providers don't really know what to do with it. And clients are just like, oh, this is just part of my life now. I'm getting old or
Yes. I
XYZ.
would say we always say in the pelvic floor PT world, just because something's common
Yeah,
doesn't mean that it's normal. So just because women historically for a really long time have been told, well, you had a baby, that's just
sure,
something that you have to expect and kind of deal with for the rest of
sure.
your life. And a lot of women experience it doesn't necessarily mean that it's
Mhm.
normal and that there's not something easily that can be done about it that doesn't require surgery or medication.
Absolutely. Absolutely. It's definitely not normal. It doesn't mean it's easy to talk about, right?
Yeah.
But that is absolutely the truth. That is definitely not normal. And so and that is totally your specialty. I've referred a couple people to you now, and I know that you do really good work. So I appreciate you doing what you're doing. It's really helpful for all of us out there. And so speaking of that, I specialize in low back pain. I love treating back pain. But one of the more recent things that I'm seeing more often is tailbone pain related to back pain. And so when we're talking about lower back and then we're diving even deeper into the sacrum or even the coccyx and trying to feel like the classic example of that I hear is it's uncomfortable sitting for long periods of time on a harder surface. And so can you talk about that a little bit? Like I know that's a little bit more common, or people may slip and fall or have that as well. What do you normally see in those types of folks?
Yeah, like you just mentioned some sort of like traumatic
Mhm.
injury, like landing on their tailbone if they tried like rollerblading or something like
Sure.
that.
Yeah.
Yeah, and then I would say during vaginal delivery, if you are laying on your back on a hospital bed delivering,
Mm-hmm.
if you think about the baby has to come out of the birth canal and your tailbone should have room to extend out of the way. But if you're laying on a hard table, it's not going to be able to extend. And so sometimes just having a baby can cause a lot of trauma to that
Yeah.
tailbone and can cause pain afterwards. So I'm seeing some patients that have had tailbone pain or injuries related to that. And then I would
Okay.
say if there's a recent weight loss, if went on a health journey, lost a lot of weight, you maybe lost some cushion in that area. And so now sitting is causing you tailbone pain because you don't have as much adipose tissue kind of
Yeah. Huh.
surrounding that tailbone. And then opposite end of the spectrum, if you've had rapid weight gain,
Mm,
you're putting more pressure on your tailbone, all of a sudden it's hurting. So I kind of see both ends of that spectrum as well. Those
sure.
are probably the four most common reasons why I would see that someone has tailbone pain.
And what do you recommend someone do about it?
Yeah, so trying to figure out maybe why it happened first.
Mm-hmm.
The pelvic floor muscles attached to the tailbone.
Okay.
So if someone has what we call overactive pelvic floor muscles, meaning they clench
Mm,
their pelvic floor muscles, that's
okay.
going to kind of pull on that tailbone, cause a lot of discomfort. So in that
Mhm.
person's scenario, I'm maybe teaching them some stretching, some breathing, teaching them how to
Okay.
shut off their pelvic floor. And then if they have a lot of like weakness in that area, maybe in the pelvic floor or in the glutes, I'm maybe focusing more on strengthening, maybe trying to build up some of that glute muscle bulk to
Yep.
give that tailbone some more natural cushion, maybe that they lost with weight loss.
Okay.
So different things. Obviously, we don't treat anyone in a cookie cutter manner. So
Yeah. Yeah.
first thing is why is it happening? And then
True.
after that, okay, what can we do about it, whether it be strengthening or more relaxation?
Absolutely. And I think you nailed it too. Like when people are trying to search, how to fix certain things or, they're feeling this and what to do after that, everybody's body is so different. And when I tell my clients when we're treating back pain, like no one's back journey is the same. And I'm assuming no one's pelvic health journey is the same as well. So it really starts with that in-depth evaluation and then moving from there based with evidence and what you've seen and work and not work, you kind of figure out the best plan for that client.
Yeah, absolutely.
Perfect. Well, if I had to summarize it, it would be one, everybody has a pelvic floor, right? So it
Yes.
doesn't matter if you're male or female, like you can have pelvic health issues. And if you're having things such as urinary incontinence or pain, it would definitely be worth your time to just consult a pelvic health therapist, right? Just someone that has a very in-depth knowledge of that area, like yourself, that goes well above and beyond the traditional exam that you may get from your primary care provider,
Mhm.
right?
Absolutely. And if you're not comfortable talking about it to your provider,
Mhm.
maybe just saying like, hey, I'm noticing some changes that I didn't notice before I had a baby.
Sure.
Um, is there a physical therapist that I can see? You don't
Mhm.
necessarily have to list all of your details of maybe your urinary leakage or your bowel
Mhm.
leakage or things like that, but just,
Sure.
ask for a referral and then you and I, the patient and I can have that conversation.
Yeah. Yeah, yeah, absolutely. Well, in the state of Florida too, you don't even need the referral, right? And so if you're
No.
if you're feeling that stuff, it could be as discreet as getting on your website,
Mhm.
the pelvicperformance.com, right? And then just filling out your form and just having like just an open conversation, and then they can invite you in their home and just dive through some of those things. And best case scenario, you're like, hey, like this will get better, or just do these few things. And then worst case scenarios, you just need to dive in and really get to know them and their pelvic floor and help them with their next steps.
Yes, absolutely. And like you, I mean, I bring all the equipment to
Mm,
them in their house. I bring a treatment
perfect.
table. I bring
Perfect.
everything that we would need. And again, because this is such a like sensitive area to
Mm,
treat, sometimes just doing it in the comfort of your own home can really
yeah.
be helpful.
Absolutely. Yeah. I mean, it's all about reducing barriers, right? And we know there's a lot of people that need this care, such as good care for their low back as well. So reducing as many barriers as you can, coming to their house on their own schedule, bringing everything you need. And if your kid starts crying or you got stuff to do, like you just do that stuff and we'll get back to it. It's no problem. So I can definitely appreciate that. I just wish more people, one, I wish that in PT school we had more education about this, right? This is huge. And then two, we continue to just to advocate for the pelvic health. It's just like your mouth, right? You need to go take care of that specific area of your body probably need to take care of your pelvic health as well. And
Yeah.
so I appreciate you kind of reviewing that. What's the best way for people to get a hold of you?
Like you mentioned, if they go to my website, thepelvicperformance.com, and they can just kind of fill out that connect information, it'll ask for their name and their email and their phone number, and then I can reach out to them. I also have an Instagram. It's my maiden name, so Dr. Jana Parnell PT. If anyone has an Instagram and they want to follow me and watch funny pelvic floor videos that I
Yeah,
make.
yeah. Absolutely. Absolutely. But that's awesome. You're located here in Jacksonville, Florida. You're mobile. You're doing awesome stuff. You're a doctor of physical therapy. You're board certified in women's health, right? But in a broader spectrum, it's pelvic floor. That's why the name changed a little bit, right? So, yeah, if anybody has any issues, I highly recommend Jana for her care. I've recommended clients to her. They've said nothing but great things. If you're having those issues, just reach out, have a simple conversation, and go from there.
Yeah, thanks so much for having me on, Michael.
Yeah, yeah, my pleasure. And I'll be in touch, but thanks again for your time.